Hello. This is to announce that a booster is now available. The Rhode Island Department of Health and the governor's press conference yesterday announced that the booster shot is now available for specific people in Rhode Island. You may remember that the FDA was researching the Pfizer booster shot only. And the result of their studies is that it has been approved on September 23rd and then provided to the CDC, the Centers for Disease Control, who also looked at the paperwork, and on September 24th approved it, and the Rhode Island Department of Health agreed on the same day. But yesterday during the press conference, they explained it a little bit more in depth, and I'd like to clarify that for you now. Boosters are for Pfizer vaccine receivers only. If you received the Moderna or the Johnson & Johnson vaccine, this does not apply to you. It only applies to people who got the Pfizer vaccine. The companies Moderna and Johnson & Johnson have currently provided their information to the FDA and the CDC, and those boosters are on their way, but the current one is only available for Pfizer. And you are encouraged to get this booster if you are 65 years or older, whether you're healthy or have medical conditions. Everyone over 65 is recommended to get it. If you live in a nursing home or a long-term care facility, you are also, it is suggested that you get the Pfizer booster if you got the Pfizer vaccine, no matter what your health is. And that people 50 to 64 who have underlying medical conditions, meaning some sort of illness, not people who are immunocompromised. That is a much more serious problem, but for people who have other underlying medical conditions, such as thyroid problems, heart problems, that group of people are suggested to go ahead and get the vaccine. Then there's a second group of people who should go ahead and are encouraged to get the vaccine booster, but it's really up to them. Those are people who are 18 to 49 who have underlying medical conditions. Again, meaning they have some sort of underlying issue. People 18 to 64 who have a high risk exposure, such as people who work in very crowded areas, they should go ahead and they should get that booster if you work in those kinds of areas. Or if you have a lot of family members in one home, and so there's close quarters, it is also recommended that you would go and get the vaccine. Others encouraged are women who are now pregnant or who are considering becoming pregnant in the near future. And Dr. Scott said that they should really go ahead and get the booster to prevent the Delta variant or other COVID variants from impacting the mother and the baby. They have done research, and it is safe and effective for women who are pregnant or considering becoming pregnant soon. Those groups of people, I know that's a lot, but I have a visual that will give you a better understanding of what those groups are. And really, what's best would be if you called your doctor directly and discussed it with them And the really doctor would know your health the best, your history, and would know whether it was the right time for you to get a booster. And again, this is only for people who received the Pfizer vaccine, not Moderna or Johnson & Johnson. A lot of children aged 12 and above have not yet been vaccinated. And those people who have not yet been vaccinated, Governor McKee asked that you please get vaccinated now. He suggested the Johnson & Johnson because it's a one-time shot instead of Pfizer and Moderna, where there are two parts to the vaccination. And then you won't need a booster because you'll need 6 months after your second shot before you get a booster. But he strongly encouraged people over 12 to get the vaccination. And you can go into the website in the Department of Health. The address is here below.